Today we have Shirley Gutkowski with us, a dental hygienist who's going to talk about blood testing in the dental office. Welcome, Shirley.
Hi, Marty.
Shirley Gutkowski is a dental hygienist instrumental in pushing our envelopes. She's a practice and industry consultant, the author and publisher of numerous books for dental hygienists, and a leader in Career Fusion, a career development program for clinicians. You can find her online, and her books can be purchased at rdhpurpleguide.com. So Shirley, are we really going to be taking blood in our offices?
Yeah, come on, you love it. I know you do.
I'm not a vampire.
Well, then leave it to your dental hygienist. Here's the thing. It's not going to be like a big blood draw where you're going to be taking vials of blood. It's just going to be what's been known to be called a finger prick, but apparently we like to call it finger nick. That's a little bit more PC. So you're just going to be taking a few drops of blood, and you're going to be sending that blood on a paper, a little piece of paper, to a lab, and then the lab will send you results so that you can make a better diagnosis and track your treatments better.
You're famous for calling a perio probe a bent wire. So what's wrong with using a perio probe?
It doesn't tell us anything. The probe was developed in the late 1800s. What other diagnostic tool do we have that is still available from the 1800s? There really aren't any. Not that you'd want to use anyway. So we really need to up our game with that. The periodontal probe tells us a history of the disease. It tells us whether or not there's been bone loss. It doesn't tell us what's happening now. There are a ton of reasons why using a probe will cause more damage in the wrong hands. And it really doesn't tell you much even with the bleeding, because the bleeding can be coming from a multiple number of reasons.
So then what are these blood tests supposed to show the dentist and the team? How are we going to treat the patient when we get the results from these blood tests?
Well, it's going to be a screening test, so it's not going to be a definitive diagnostic test. The most important two are the A1C number, which tells you the average blood glucose of your patient. So if you are having a patient with bleeding on probing, and normally you would go right into a periotherapy situation, you really need to know what their blood glucose is like, because we have almost 50% of those with diabetes that don't know they have it. So right there is one really important thing to do. Another is to get their C-reactive protein number. The C-reactive protein is a mediator, and it shows up when there's inflammation in the body. And it can come from a number of different places, so it's not really definitive. But once you treat what you consider to be a periodontal infection, the C-reactive protein number will go down. If it doesn't go down, then you have another disease that's a comorbidity kind of a situation, or some other totally separate reason for that.
So how do you recommend an office getting started with doing this type of blood testing?
There are at least 2 companies right now who have chair-side blood tests for dental practices. They're very simple, and they're real easy to do with your patients. I would recommend that you contact one of those companies and just have a little in-service between your staff members, and you all do this blood test on each other and send it in and see how that comes back, and then develop a way to relate that information to your patient.
What about patient acceptance? I mean, nobody's used to coming to the dentist and getting their needles, not in their mouth.
I know what you mean, but they weren't very receptive at first when we started wearing gloves and masks either. And dentistry has to continuously evolve, and this is part of the evolution. And it's also part of the oral systemic link. You're going to get a lot of points by incorporating blood testing into your practice.
Thank you, Shirley.
You're very welcome.
That was a really informative discussion on diagnosing periodontal disease with blood tests. You might want to think about this for your office.